Hi everybody in YouTube land. What is really going on with me is more than just migraine associated vertigo. I also have classical migraine, and I also have convergence excess, which was convergence insufficiency, but it flip-flopped according to my my former vision therapist doctor. And so what it means is that I have migraine with and without headache. I have migraine with and without aura. I have migraine with and without vertigo. And I have the convergence excess, which can cause its own headaches and its own vertigo. So it becomes very confusing when to take Imitrex and when not to, because Imitrex will only work if the headache is from migraine. It will not work for any other kind of headache. And it's very confusing to sort out what is causing what and what is doing what. And when I talk to the average doctor, medical assistant, or nurse, I am talking way over their head. Even my neurologist, I'm speaking over the head of her medical assistant and her nurse, because of them having not heard of and or knowing very little about at least some of my diagnoses. So I just had to fire my former primary care physician because I was having to constantly explain and educate her and the nurses at that medical clinic and her medical assistant because of how complicated and complex and outside of the box my diagnoses are. And I cannot constantly educate and re-educate every medical personnel who I speak with on the phone, in person, and otherwise. I cannot do that. It is extremely frustrating and exhausting, and I was having to do that even when I was sick with a migraine. So that has been what has been going on with me. And so I just now changed my primary care doctor to one who claims to take on complicated cases and does not do anything that is simple, such as basic medical exams and things like that, but just only does complicated stuff. And I just had a long phone call with my insurance and with that person's medical clinic where she practices to try to get everything cleared away before I start with this other doctor. And so I will be starting with her on February 27th. So that's what's going on. I have migraine associated vertigo, I have classical migraine, I have post-traumatic stress disorder, I have convergence excess, I have auditory processing issues, and I have a back injury all at once. And a lot of the symptoms overlap with each other. And if I have one disorder that's being triggered in some way, it can end up setting off some of the other disorders as well. I have a hunch that most likely my case is so complicated it will probably go over the head of even this primary care doctor. But since I don't know her and I haven't gone to her yet, I can't say for sure what will happen. I do know, though, that my very complicated case was not even handled properly by my former headache specialist, who I used to go to in Seattle. Because although she could give a basic Webster's definition of convergence insufficiency, apparently she missed many of the symptoms of it that overlap with migraine-associated vertigo and classical migraine. And apparently was a complete surprise to her and her staff and whatnot when my vision became so poor that I wasn't able to reliably get in there to appointments, and so I had to terminate. Because if you keep having difficulties with being reliably able to make it in there because of your vision deteriorating and you don't get the help you need to deal with your deteriorating vision, how can you possibly get over there? I mean, telepathically? What? So I'm in the process right now of writing a complaint letter to her and whoever deals with her at the clinic in Seattle, explaining what happened with my complicated case and what exactly was missed and why I was not able to continue going to see her. So when people ask me, are your symptoms improving? Is your MAV under control? I can't really say yes or no entirely, because there's a lot more to it than that. So I know I'm not collapsing. I know I haven't been falling over, with such severe dizzy spells that I can't stand up. But how much is really truly under control or what, I can't give much of a straight answer, because it's just really complicated and strange and complex. So I'm hoping that this new doctor, at least new to me anyway, is going to be excuse me, going to be a little better fit. Anyway, so in order for me to try to understand what's going on with my really wacky, complicated, nutty body, I'm having to study anatomy and physiology on my own, and study medical terminology on my own, and study basic medical knowledge on my own, just so I can try to make some kind of heads or tails of what's going on. And so that when I talk with doctors and specialists, I can explain something of what's going on to them, or at least on an relatively basic level. Anyway, so I guess I'll talk to you later, but for now, that's kind of what's going on with me. Have a great day, everybody, and take care.